Welcome to Climate Change and Health in Small Island Developing States focused on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the Zoom screen. You should continue to keep this browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the speakers. This session is being recorded. Thank you.
Good afternoon all. I am Jeremy Cullimore, and I am the moderator for this session. I am a disaster risk management specialist and an honorary research fellow at the University of the West Indies, and for some years served as the executive director of the Caribbean Disaster Emergency Management Agency. Today, I have the privilege of chairing this session on integrating health and disaster preparedness and response. I do have an interesting panel with a diversity of experience who will focus on the issues and themes related to health and disaster preparedness and response in the Caribbean. If nothing else, the COVID-19 experience has really given us a context of the multi-hazard and integrated nature of disaster preparedness. And therefore, we look forward to hearing from our panelists, who include Ms. Elizabeth Reilly. Ms. Elizabeth Reilly is the Executive Director at the Caribbean Disaster Emergency Management Agency, SIDS. She has over 20 years experience in disaster management at the regional and international levels in various capacities. She is currently the Vice Chair of the ICG Caribbean Early Warning Systems Group of Experts on Coastal Hazards. Ms. Reilly is currently playing a leadership role in the coordination of the region's response to COVID-19, and she will be speaking on integrating health and disaster response to SIDS experiences. She will be followed by Dr. Jacqueline Besessar McKenzie, Chief Medical Officer, Ministry of Health and Wellness in Jamaica. She has over 25 years of experience in the healthcare system in Jamaica, and was the first emergency physician to be appointed as a consultant in the public sector. She has served in several leadership positions across the health sector in Jamaica, and is a member of the Preparedness and Response Emergency Committee of the board of the Office of Disaster Management in Jamaica. And she will speak on integrating health and the disaster preparedness and response really on the Jamaican lens. She'll be followed by Caroline Radix, who is the head of Human and Social Division in the Organization of Eastern Caribbean Commission. She is the head of that division, which oversees education, health, and social protection. She's a public health physician and a health administrator and has worked in several areas in the Caribbean. And she will be speaking on the issue of resilience and agility of the Oecs SIDS health systems and disaster response. And our final presenter will be Dr. Susana Barato. She's a member of the Climate and Health Group of the Ministry of Health in Cuba. And she has worked in several positions in the Cuban health system since 1991, including specializing in family medicine at the Institute of Medical Sciences and epidemiological research at the IPK. Since February 2020, she is an advisor in the PAHO office in Cuba, and she will be speaking on learned lessons of early warning systems for infectious diseases in Cuba for preparation and response to climate change. It should be noted that this is an all-female panel, and certainly we look forward to hearing the exciting news from you. I therefore invite Ms. Elizabeth Reilly to make her presentation and to remind the panelists that you have 8 minutes to make your presentation. Ms. Reilly?
Thank you very much, Jeremy, and good afternoon to everyone. It is really a pleasure to share some thoughts on the topic of integrating health and disaster response and the specific experiences of SIDS. In my 8 minutes, I'm going to look specifically at some of the matters arising related to governance arrangements on the integration of the health sector and regional disaster response, to talk a little bit about existing structures for response to health-related emergencies, and then to really touch on the objective of the conference to zero in on some of the lessons and suggestions for research agenda going forward. So the Caribbean Disaster Emergency Management Agency has right now 20 participating states. And what I will say is that our states are very diverse in terms of the hazards that we face, as well as the capacities. The role of the agency is articulated in the blocks to the left, but I won't go through those in too much detail. What I want to focus on really is this very complex multi-hazard environment within which we operate and work. And the hazards that we face, of course, include biological hazards, such as the COVID-19 pandemic, which we're currently experiencing. But it's very instructive to note that the other types of hazards that we face in the region, those which are climate related, including severe weather events and cyclones and droughts, as well as those which may be seismic or geological in nature, the implications and the impacts of those hazards often have implications for health, and particularly public health considerations. And these are usually linked to issues such as the breaches of water systems, water supply systems, sewage systems in the aftermath of events. When we have extensive flooding, this can also cause issues related to proliferation of vectors such as mosquitoes, etc. And we know that within our region, we do have some challenges with respect to diseases that are becoming endemic, including dengue, chikungunya, Zika, etc. So when we discuss health within the context of hazards, it is a very complex interface that we're discussing. So when we look from a strategic perspective, the health sector is very clearly identified within the Regional Comprehensive Disaster Management Strategy 2014 to 2024. And we have an overarching goal of having more resilient states within our region. But if you look at the higher level outcome results of the CDM strategy, which are outlined in the red blocks towards the top of the diagram, you will note that one block from the right, sector integration, is one of the priorities that we look at. And the health sector was in fact identified as a priority sector for resilience, action, and disaster risk management mainstreaming from the start of the CDM strategy. And we have been building out that relationship through our health sector partnerships led by CARPHA, the Caribbean Public Health Agency, and PAHO. We also focus a lot on institutional strengthening. And in doing so, the health agencies at the national level are also integrated in the work that we do. We also spent quite a bit of time in the aftermath of Hurricanes Irma and Maria in 2017 articulating our resilience framework. And this is instructive in resilience building for the health sector, because all 5 of the pillars which are articulated here, social protection, enhancing economic opportunities, safeguarding of infrastructure, in this case, the critical infrastructure of the health sector, environmental protection and operational readiness and recovery are very much relevant to the health sector as well. Now, from a governance perspective, we recognize that we needed to make spaces to allow for the types of complex interactions and conversations that need to take place for resilience building to occur. So we established in 2007 our CDM Coordination and Harmonization Council, and health was prioritized as one of those subsector committees. And it's been one of the very active committees since 2007. These are some of the functions of that committee, and whilst I won't go through all of those, I think one of the critical things that the committee really works on is captured at block number 1, where it's really focused a lot on identification of those challenges and gaps related to the implementation of health disaster risk reduction initiatives in the health sector. And we have been working on this collaboratively with our health partners for some years now. On the response side, I wanted to highlight that the health sector is an integral part of the regional response mechanism, which is the region's arrangements for how we organize response to significant impacts in any of our participating states. Specifically, the health sector is spoken to directly in the regional coordination plan, which is the second block down from the left when we look at regional coordination plans. And pandemics and epidemics are specifically identified as hazards with very specific operational procedures that should be followed if these take place in the region. And in addition, we tap into our health sector partners quite a bit with respect to the regional response teams, and drawing from the Pan American Health Organization, CARPHA, and other related organizations. They support the assessment processes at various stages in the aftermath of events. In the case of COVID-19, this was an instance in which we had to pivot quite quickly to ensure that we had the appropriate governance arrangements in place to manage what is now, as we can see, a very protracted hazard event. It has been going now for over 18 months, and really the final duration of that, I think, is still unknown. What we did in early 2020, recognizing that we had to create a mechanism which allowed that sustained conversation for the monitoring and management of COVID-19 as it progressed, was to establish a specialized cell within our regional coordination center. And you can see that highlighted in orange on the screen. And what that has successfully done is to allow us to have a bridge between the mainstream response coordination mechanisms in the region and the critical discussions that we needed to have with the health sector to really understand the specifics and nuances as they have emerged. And you well know that COVID-19 has been a very dynamic type of an event. And so the management of it has also been very dynamic. And I want to thank the partners who have supported this coordination cell for the past 18 months or so, including the Oecs Commission, which is actually on the panel with me here today. Very importantly, I just wanted to mention also here that this mechanism allowed us to remain in close contact with the political directorate of the region, and this has been incredibly important because of the policy implications of the COVID pandemic. So in concluding, I just wanted to zero in on some of the lessons that have been emerging and to suggest some areas where we may want to, through the identification of lessons, look at the regional experiences that might be informing the research agenda. So first, the issue of governance. I think we've had some very interesting models evolving in the Caribbean region in terms of the structures, governance structures that have been used for the management of the pandemic, where in some instances we have seen our health emergency operations centers taking the lead on the pandemic, supported by the broader EOCs. And in other cases, it has been the EOC leading with the technical advice coming from the health EOC. I think this is what we study. In addition, social protection systems and human rights issues have emerged, particularly around vaccines, psychosocial support. This is related not just to the COVID pandemic, but also to other hazard impacts in the region. From a policy perspective, I think the types of policies that have been selected to provide flexibility and agility in the systems have been instructive. And finally, methodological approaches and really looking at how we can standardize those is going to be important. Thank you very much.
Thank you very much, Ms. Reilly, for your very clear, focused, and inspiring presentation. Now I'll ask Ms. Jacqueline Bessessor Mackenzie. Your 8 minutes start now.
Okay, I want to thank, first of all, the organizers for asking me to present at this conference to give Jamaica's viewpoint on integrating health and disaster preparedness and response. So just to give you an idea where Jamaica is, we sit in the Caribbean Sea. We're an island that is divided into 14 parishes. And Jamaica, by virtue of its location, is in the pathway of several natural hazards. And the Oecs in 1991 had said that a combination of geographic location, climatic conditions, and limited capabilities for natural hazard assessment makes the Caribbean countries, for example, Jamaica, susceptible to the disaster natural hazard presents. Well, in terms of the capabilities, I think we have improved significantly on that. However, our geographic location and our climatic conditions still makes us quite vulnerable. Over the years, like the rest of the world, and in particular the rest of the region, we have moved from being a reactive response to disasters to being more proactive. And this has been led by several international conferences and changes that have been done on the international scene in international organizations, so that we have moved from response to focus on disaster mitigation, as well as a greater emphasis on developmental approaches to managing disasters. In Jamaica, we have in terms of the national coordination, we have the ODPEM, which is our Office of Disaster Preparedness and Emergency Management. And this was formed initially as Office of Disaster Preparedness and Relief Coordination in 1980. And we had the emergence of the National Disaster Act in 1993 to give us a legal framework in which to operate. In 1993, we also changed from ODPERG to ODPEM, and the National Disaster Act was revised in 1997 to become the Disaster Preparedness and Emergency Management Act. But this was repealed in 2015, and we had a new Disaster Risk Management Act that was promulgated, which reflected the new thinking and relating to disaster risk reduction in context of sustainable national development. And this is intended to provide the legal framework upon which disaster risk reduction and disaster risk response operations take place. In terms of our health system, the Ministry of Health and Wellness is responsible for policy development and the monitoring of the health status of the country. And we have 4 technical branches within the ministry that provide oversight for health programs. We have 4 regional health authorities that are responsible for service delivery, and this delivery is done through 318 primary care centers and 25 hospitals. Now, the Ministry of Health and Wellness has an ongoing responsibility for the health sector preparedness, response, and recovery in response to disasters. And in terms of our integration into the national framework, I think that this is well integrated. We have the ODPEM, which is our national body, but the ODPEM has several subcommittees, of which one is health, which is an active committee where it's chaired by the Ministry of Health and Wellness, and it provides oversight to the preparedness and mitigation activities that occur throughout the year, throughout the different health sectors. The ODPEM also has parish disaster committees, and the health parish persons also between the different stakeholder groups in terms of managing disasters. Within the Ministry of Health, we have our National Disaster Committee, and within the regions, we have our regional committees and our parish committees. And these all transform into emergency operations centers in terms of responding to any disasters. The Ministry of Health and Wellness demonstrates its commitment towards emergency disaster management, because emergency disaster management is actually one of the 4 main technical branches of the ministry. And this is subdivided into 3 units: emergency medical services, disaster risk management, and international health cooperation. And therefore, with this dedicated team of persons who are working throughout the year, we are able to manage quite well in terms of our coordination or response activities. Our preparedness, our cycle of preparedness each year goes through the preparation of our disaster plans, the carrying out of exercises to test these plans. Whenever there is an activation, and we activate at different levels in response to different things that happen across the country. And we are able to demonstrate the coordination between the different levels of emergency operation centers, which has been demonstrated quite well through the pandemic. after each disaster, and as we're seeing with COVID, there are gaps that are highlighted in our policy and legislation that we tend to tackle throughout the year. Our international health regulations unit focuses a lot in terms of the building of our core capacities. The stakeholder advisory group is very active, and so therefore we have that integration in terms of all the different stakeholders that participate in providing that response to any kind of emergencies. Our disaster risk management unit is responsible for ongoing risk analysis, different studies being done in terms of vulnerabilities, and of course, the management of the SMART program in terms of building resilience. So essentially, in summary, the Ministry of Health has a disaster management framework, which is aligned to the national framework, coordination and reporting at all levels, and disaster risk management is ongoing and includes prevention, mitigation, and preparedness activities, as well as response and recovery. Thank you.
Thank you very much. Now I invite Dr. Caroline Radix.
Yes, thank you. I was just having a little technical difficulty there in starting my video. So I'm going to share my screen. So thank you. First of all, I'd like to thank the organizers of this very timely and relevant conference for having me here. And I am very pleased to be among such a distinguished panel. My talk today is going to be on resilience and agility. It's a little bit different. My intention is to change your thinking a bit about how we respond to disasters in small island and developing states with a look at resilience and agility. So what is resilience? Resilience has been described as the ability of a system to undergo a shock, a change, its ability to adapt, to respond to that change, but to continue to function in its normal functioning and to return to its normal functioning without much interruption. The term resilience, in my understanding, and I'm sure there are others on this panel who can speak a bit more to it, came into vogue in the disaster realm somewhere in the early 2000s as a sort of an alternative look, rather than focusing on vulnerability, but focusing on what needs to be strengthened in order to mitigate against vulnerability. So if you think about the balance, we are, as has been described by both of the previous presenters, very vulnerable due to our geography and our climate. So what are the things that we can build in order to balance this vulnerability? You know, what are the structures that we can build so that when we're hit and pieces are removed, that structures are able to remain standing? Looking at the past 7 to 8 years, we can see that there's been an escalation in terms of the number of climate and climate-related events that affect health and direct health events in terms of infectious disease outbreaks throughout the Caribbean and the Oecs region. I've sort of mentioned a few here from the St. Lucia perspective, but you can see, as has been said before, that we continue to be a very vulnerable region, and I believe the issues of climate change are escalating the vulnerability of the region. So in looking at resilience in health systems, specifically if we focus in on Ebola, in 2014 to 2016, with the outbreak in West Africa, larger than we had ever seen of Ebola before, resilience in health became something in vogue. Health systems that collapsed under the response to the Ebola outbreak reminded us that we had to focus on resilience in health systems. And there are many frameworks that began to emerge. But I wanted to just look at the WHO health systems framework, which fits nicely into the consideration of resilience for health systems. Sometimes this framework has leadership and governance in the center of a wheel. And I think both Dr. Reilly and Dr. McKenzie spoke to the importance of leadership and governance in the resilience of health and other disaster frameworks in the Caribbean. The other areas, of course, financing, workforce, medical products and technologies, information and research, service delivery, and these result in the resilient issues of responsiveness, financial risk protection, and improved efficiency for health outcomes. Let me take a moment to just share with you one example. The Oecs pooled procurement mechanism, previously the Eastern Caribbean Drug Service, which has been around since 1986, allows for pooled procurement of medicines and medical supplies for 8 of the Oecs member states that share a common currency. And it allows, obviously, for economies of scale, for value, and for access, especially when it's difficult to get things on a small quantity or small scale, given our small population. But the benefits go beyond this in terms of cooperation, technical assistance, and sharing. And most recently, with Irma, Maria, and with the COVID-19 outbreaks, we've seen in real time how the sharing of resources between our islands have increased our resilience. Let me just switch gears now and speak to you a bit about agility, which I believe is a little bit different. While resilience balances or mitigates against vulnerability, vulnerability gives birth to agility. And so in this region, because of our continued vulnerability, we are an agile region. And what is agility? Really, it's the ability, you look at those footballers when they're doing agility drills, they sort of change direction quickly, many times, in quick succession. And when you see it play out on the field, it really is about dodging many persons, but to get to the goal. So it's about speed of response and number of changes per unit time, but it's not just, moving around quickly. There is precision. So it's about targeting the issue without disrupting everything else, sort of like we do in radiation therapy. It's about comprehension, being clear on the what. What are you trying to accomplish? Get the ball in the goal, so that you can do many different things in the how on your way to the what. And it's about efficiency, because if the cost of change is too great, either in terms of time or in terms of money, then we're unable to keep changing at that rate or at that pace. And certainly, being small island states within this vulnerable geographic and climatic conditions, we have become very agile. So I'm going to end here with a quote from Brené Brown, who has nothing to do with disaster response, but whom I follow avidly, that vulnerability is the birthplace of innovation, creativity, and change. I have a picture here of St. Jude Hospital in St. Lucia, quite a story, a hospital that had to be in a stadium because of a hospital fire. You can find out more about that on your own. But let me just end here by saying that we need to ensure, as we move forward, building our resilience in our health and disaster systems, we also take account and use our lessons of agility to move things forward. I thank you.
Thank you very much, Caroline. Now we invite Dr. Susana Barato.
I would like to thank the organizers of this important panel for inviting me to present the lessons learned from the early warning system for infectious diseases in Cuba in preparing for and responding to climate change. In Cuba, research related to climate change and health have been prioritized. An intersectoral and multidisciplinary approach to the problem is adopted. Research and health centers collaborate in multidisciplinary studies. Among those centers, we can cite the Pedro Curie Institute of Tropical Medicine, the National School of Public Health, the National Institute of Hygiene and Epidemiology, the Cuban Red Cross, the Meteorology Institute, and so on. In this last one, the INSMED specifically participate the Climate Center and the Provincial Meteorological Centers. Organizing our work through this consortium of interdisciplinary research centers provides us with new tools and approach on how to mitigate and adapt to climate change based on national priorities for the protection of the environment and health. Which are the lessons learned on early warning systems? Well, the forecasts and early warnings issued as a product of the analysis and modeling of climate and epidemiological variables have implied an immediate challenge. They must be carried out and sent to the Ministry of Health with enough time to allow the decision makers incorporating them in the management of communicable and non-communicable diseases. The early warning system has served as an input for the health authorities in the management of outbreaks, epidemics, and endemic diseases. The monthly prediction and the quarterly outlook have been achieved for various infectious diseases such as acute respiratory infections, specifically on the circulation of influenza viruses, respiratory syncytial virus, and more recently, the SARS-CoV-2 virus. Also, for acute diarrheal diseases of bacterial origin, dengue virus, and for infestation from Aedes aegypti mosquitoes. A key issue has been the sustainability and systematization for more than 30 years of early warnings for health in association with climate conditions. An important lesson learned is the joint work between health professionals and climatologists involved in surveillance, who have had to learn using and interpreting the early warning system's outputs, as well as the concepts and modeling for both signs to incorporate them into the epidemiological control programs in the country. The relevance of this early warning system in the detection of diseases has been recognized by government authorities. The most recent example is SARS-CoV-2. An article in the national newspaper in the National Science Day acknowledged the role of Cuban science in confronting COVID-19, in which reference was made to the early warning system dedicated to the prediction of dengue, influenza, respiratory syncytial virus, and SARS-CoV-2 virus circulation. Also, the implementation of 2 new early warning systems dedicated to forecast the circulation of the dengue virus in the country, the circulation and variability of influenza virus, the circulation of syncytial virus, all of them at the municipal level. An example of an early warning system output is the contribution to the atlas of COVID-19 in Havana City, which was recently published. Another example is the monthly bulletins with the forecast of different viral diseases behavior, such as influenza, RSV, and dengue. This is produced monthly since more than 3 years ago. Besides, during the last 2 years, with the pandemic of SARS-CoV-2, the forecast of this virus circulation in the country has been issued. In this slide, you can see the map for July 2021, and I left the chart with the circulation pattern for respiratory viruses. And finally, it's important to remark that the early warning system has been very useful for decision-making in the health sector. A timely and continuous flow of information to the National Division of Epidemiology at the Ministry of Public Health has been provided for more than 20 years of diseases affected by climatic variables. 25 years of a strong collaboration between the Tropical Medicine Institute and the Institute of Meteorology, with the production of 288 monthly forecasts and 96 quarterly outlooks published in the IPK Epidemiology Bulletin, as well as 15 joint publications in high-impact journals. Although the use of forecasts, outlooks, and publications in master's and doctoral theses. Finally, a 5-year joint project on high-impact topics with development of models for prediction of different bacterial and viral diseases. Thank you very much.
Thank you very much, Susana, and I want to thank the panelists for helping us to get back on time. The floor is now open for questions, and in the chat, there is a question which I want to first focus on, and this relates to how the response to COVID integrated into the disaster preparedness and response. There is in the impression that the disaster preparedness committees were left out of this process in COVID management, despite the expertise that lies within. So could I ask Liz Reilly and Dr. McKenzie, Mrs. McKenzie, to respond to that question? Liz, you want to go first?
Thank you very much, Jeremy. I was actually trying to pick up the question in the chat itself. I was focused on the one that had said Elizabeth Reilly. So could you just do me a quick recap on that one?
Right. So in essence, they were querying the extent to which the disaster preparedness architecture, traditional system, was engaged in the COVID management.
Ah, yes. Okay. Thank you very much. And Jeremy, as I mentioned in my presentation, we had very diverse models with respect to that level of engagement. And what we also saw is that the level of engagement changed over the duration of the pandemic. And in fact, I think it continues to change. So in some of our states, the National Emergency Operations Centers were appropriately stood up at the start of the event. And I think that was the correct action, because the COVID pandemic requires an all of government approach to the management and an all of government approach to the response efforts that were going to be required and the types of national level assets and resources. So in many states, the national EOCs led the discussion with the guidance from the National Health Emergency Operations Systems, or where those national health EOCs were not in place, the ministries of health provided quite correctly the technical health-related guidance to inform the actions of the EOCs. In other territories,
okay.
Just one final point.
Yes.
Just very quickly, I was going to say that in other territories, what we saw is that the national health EOCs led the discussions with some support from the broader national EOCs. The level of engagement of the national disaster offices themselves also varied. Thank you.
Thank you very much. So Jacqueline, could you affirm whether that was the same experience in Jamaica? Because we have quite new, and as quickly as you can.
Right. So in Jamaica, we would have seen a mixture of responses. What was consistent clearly was the health response in terms of our disaster management structure, in terms of the standing up of our Health Emergency Operations Center at the national level, and the standing up of all our regional EOCs and parish EOCs. So that coordination and analysis of data that was done every day up to today, we have consistently been managing through this hierarchy. In terms of the support from the national EOC, certainly the National Emergency Operations Center was stood up at the beginning of the pandemic and remains up to now in a supportive role to what is happening. But what we have found is that we've also had several other committees that have formed that have taken on some of the roles. So for example, we have the subcommittee of cabinet that would brought all the stakeholders from the ministerial level together. We would have had the parliamentary committee on COVID. And in terms of the response, in terms of each type of response, you would have had different committees that would have formed, that would have brought in multiple stakeholders to deal with a particular situation.
So you're reinforcing the point of Ms. Reilly that there were new governance systems that emerged. So thank you very, very much. So Carleen Raditz, can you speak to how the OECS has been working to integrate NCD's care into the disaster response, preparedness and response? As the
certainly, and I'm taking your cue that I have to be very quick. So let me say that after the Irma and Maria, I call them the twin disasters that happened, which affected almost more than half of the OECS member states, it became clear that NCDs was an area to target. And so we specifically began targeting both guidelines, teaching, etc., to ensure that shelters are better prepared to deal with NCDs, diabetes, hypertension, and persons with those complications during the time of disasters. So this gap was identified and it's being addressed.
Thank you very much. Thank you very much. And this one now is for, okay, so we have a little more time than we anticipated. Thank you because of your commitment to this time schedule. And I will certainly come back to some of you on some of these issues. Now, with respect to Dr. Barato, are there efforts to combine the early warning system for health-related problems with those of climate-related extreme weather events? You're muted. ¿Tú estás silencio?
Very mute. Sorry. Well, yes, we have a communication strategy in the media related to climate and its influence in health. And related to the other question, yes. For example, during the hurricane period, through the civil defense, the people prepare, or the government prepare the people using these early warning systems, for example, during the flows or alerting about rain, the possibility to acquire any disease, for example, leptospirosis and others which are possible to appear in this situation during these periods. For example, now we have the Sahara dust over our country, and there is a warning and early warning about the possibility of people who are very allergic have to protect in the houses, and some other message which appears So it's related in our country. There is a relationship between health, between meteorology and climate institution through this organization is governmental named Civil Defense. These civil defense have plans which include not only health, disasters of health, for example, now with the coronavirus, but also chemical or physical disasters, climate disasters. So when one of these appears, just these plans are activated in the corresponding program, and every at country level, or provincial level, and municipal level, these plans are adopted and activated and relate each other in the different sections, in different parts of the plans.
Thank you very much. There is a question here about lessons learning, especially in relation to organizational developments. And each one of you, from the lens that you sit at, could you say what were the organization learning outcomes from your experience today in this health disaster preparedness and evidence through the COVID experience? So let me go back the circle again. Liz, I will start with you, and then I'll invite Cardine, then I'll invite Jacqueline, and Susana will finalize.
Yeah, thank you very much, Jeremy. I will say two things. One is related to the expanded notion of what readiness for hazards mean. I think many organizations looked at the usual suite of natural hazards in terms of their readiness programs. And in many instances where pandemic and epidemic were mentioned, but never received a full treatment in terms of the actual planning and exercising. Second, from our perspective, I would say the importance of the regional posture of solidarity. I think that has been a very important lesson at the organizational level across the CARICOM space, and really the power that can be leveraged by bringing the regional organizations together and really marrying the mandates that those institutions have been given towards the broader support of the people in our states.
Thanks. Jacqueline?
Right. I think the lessons learned and have been cemented has been about coordination. Over the last couple of years, we have responded from the health sector to chikungunya, then Zika, Ebola, dengue. We were coming out of a dengue epidemic in Jamaica when we went straight into COVID. And so in terms of our coordination from the health sector and our ability to respond, I must say that over the last couple of years, we have had a lot of work done with PAHO in terms of strengthening our EOC coordination, and it really tied together very, very nicely, first with dengue, and allowed us to move very smoothly into the management of COVID. That I agree with the previous speaker in terms of from the national level, the experience in managing epidemic and now pandemic. That needs to be cemented, and you have to look at that from that national level, because even with the other diseases, chikungunya and dengue, what we did see as well was that there were other committees that were formed that brought in the multi-stakeholder approach. It didn't revert to the structure that was supposed to be in place from that level above health. For health, it has worked very nicely for us, but we have been doing this repeatedly over the last couple of years. And so the experience, we have really built on that.
Thank you very much. Carlene?
Thank you so much. I mean, I think we're all on the same page. Someone asked about examples of agility, and I think most of our examples of agility lie within that central leadership and governance building block of the health system structure. And it's been said by both Dr. Reilly and Dr. Professor McKenzie. We really saw agility in terms of our coordinating mechanisms, things we need to build up and put into place in order to be able to respond differently, learning from things we've done before and adjusting to the new. So I think these are good examples of the way in which we are able to be agile in our small island states within the Caribbean. However, sometimes we need to be able to find ways to make sure we can repeat it. But we are able to shift and move quickly. And so I just wanted to say that I think this is one of the major lessons learned.
Thank you very much. Dr. Barato?
Yes, thank you. Well, I think I talk about that issue in my presentation because I talk about the intersectoriality and coordination of the work with the group who is working together to prepare this early warning system. And this is the same for the organization of the work are all. I said, yes, we have a very strong civil defense organization with those plans, very prepared with all the minimal details, and every years are updated according to the situation. And this, for example, during the hurricane, or there are very determined stage, 4 stage. The information appear when the Meteorology Institute issue the first information about this hurricane is coming, and depending of the place is situated, the country is being activated. The provinces from west to east, from east to west, for these 4 stage information first, then alert, then alarm, and after the recovery stage for all the places affected.
Gracias muchas.
Sorry?
Gracias muchos.
So,
thank you very much.
All the system is prepared and follow these steps, step by step. And after that, well, the work is better, is fluid, and the recovery also is well done with these important plans.
Thank you very much, Susana. Thank you very much. Thank you very much. I think that what I understand, you've made a point. You said you made a point earlier in your presentation. So I'd like to take the time to wrap up on some of the key messages that I heard coming from this very robust conversation. The first one is that there already was a platform of collaboration between health and preparedness in the region, at the regional level and at the national level. And certainly these events over time have tested the governance arrangements when events do emerge. Whilst we've seen some good practices, there are clearly some spaces where these do not operate, and it may recall for reflection as to what is explaining the differential behavior in terms of the government's processes. Is it lack of awareness or indifference or whatever it is? And I think that's something we want to address. Certainly, there were good lessons in learning from prior events that help us to manage this. And I think that was pretty clear from the messages that were coming through. Additionally, the importance of the multidisciplinary and interdisciplinary engagement across this dynamic has surfaced as a key consideration. And one of the key messages that I took from here in terms of driving future action is vulnerability as an opportunity for agility and helping to shape thinking about those spaces for engagement and action. And I think that is a good reflection. So I want to thank you all for this very intense engagement. and these good nuggets for actions going forward. And certainly, I hope we continue to have a successful health conference in the Caribbean. Thank you all very much.
Thank you. Thank you all.
Thank you.
So the session is now to an end, and now we can certainly join the other one. Thanks.
Thanks, Jeremy. Have a good afternoon, everybody.